Now, somehow we have entered, this seems astonishing, week 6 of lockdown. 35 days where life as we know it has changed completely, a new normal as it's being called. Scientists and health experts are saying it's not the time to end restrictions, but Boris Johnson is back today, so measures could be reviewed again. Indeed, he gave a speech outside Downing Street this morning. So in terms of the epidemic, where are we now? And what do we want to happen next? Well, let's catch up with Dr. Duncan Robertson, who's watching this for us. Duncan, morning.
Good morning, Ben.
So, look, where are we in all this? There's lots of talk of peak and how we get out of lockdown. Where are we?
Well, I think, we've got over that sort of initial hump that we talked about in terms of the numbers of infections are going down. And thank goodness, because, we're all spending a lot of time trying to avoid us infecting other people. But there's still, quite a lot of people going through the system of hospitals and catching the infection, and that's going down, but we're not quite at the sort of levels that I think New Zealand said that they're down to 0, and we're not there at all at the moment. And that's, I think, why the Prime Minister and others are very keen that we carry on these social distancing measures so that we don't get this second peak.
No, I watched his speech this morning. I don't know whether you managed to see it or not. But
I didn't manage to, unfortunately.
I mean, I couldn't. There was no. I mean, he was reiterating that now is not the time for letting up, and obviously he's concerned about a second iteration of this. That he said, at least in his speech, would be sort of economically catastrophic to open everything up again and then have to shut it all back down again. He also talked about a phase 1 sort of beginning to come to the end of phase 1 and into phase 2. Do you know what those would be?
Well, I think it's sort of, we've had this, I think, there was a bit of a shock when we realised how virulent this disease was and how many people were being infected and ultimately how many people were dying. So I think we put in these social distancing measures, maybe slightly later than some other countries. And as a result, there's been this quite large number of people who have been infected and ultimately, sadly, quite a few people have died. So we're now sort of, we, as in the government, are trying to reduce that and trying to make sure it goes down to a level that is manageable and then do something different. And I think there's a lot of work going on still to work out what that second new normal is, because we're still, I think, people, modelers are still trying to work out exactly how this spreads. So there are models, but they're trying to make sure they want it exactly right. And there's a lot of work going into, for example, is it 2 meters? Is that exactly the amount you want to spend around other people? So, a lot of work is still going on. And I think the government's keen not to announce anything before they know more about it.
There was, I'm sort of conscious of not sort of chasing rabbits here, really, but there was something over the weekend I saw that lots of people were talking about, and I think some countries are implementing it or are considering it, this idea of creating social bubbles, if you like, where you can, I think one country's looking at sort of 10 people that can be in that bubble, and they all have to agree to just be in that. So it might be 10 family members or friends or whatever, and those people can mix, but they can't mix outside the bubble. Is that realistic?
Well, I think it depends how much you trust your family and friends, doesn't it, really? I mean, it's like any sort of infection. You can think of others. Where do you trust the people around you? Now, many people would say, no, I haven't gone to see anybody, I haven't gone to see any neighbours, but they may be infected. And really, if you can trust everyone around you, then that's great. So my family is isolated from everyone else, and I'm very confident that we're not going to start infecting each other. But, how do I know that about my neighbours? They may have, accidentally been infected, and still there's this lag. So people aren't sort of lighting up in lights to say that I'm infected. So even if you do spread your network a little bit wider, you still have that risk. But I think it's an important point that you want any sort of spread to be local. And I think the problem is that so even if that group of 10 does get infected, it is still isolated. And as long as those groups of 10 aren't linked to other groups of 10 who are linked to other groups of 10, then that's fine. I think, there's a lot of work in social networks about how close you are to other people. And there's this sort of Stanley Milgram in the 1950s did an experiment about, the 6 degrees of separation comes from that, where actually we're all very much linked to other people. And so if those 10 people are all isolated, it's fine. But what you don't want is this sort of random mixing, for example, in pop concerts and other sorts of things, where people from lots of different groups come together and mix.
I mean, that's interesting. We were talking about pubs on the programme a little bit earlier on, and I know that one of the things you've looked at is how to create some normality in different and more difficult environments, like a pub, for example.
Yeah, so I mean, if you think about, assuming this 2 metre distance is what's safe, and as I say, there's still a lot of work going on about that. But how do you actually get, people within a pub? You mentioned pubs. How do you get them to stay apart? And if you think about, what's the best way of packing people in whilst keeping them safe, and you can sort of think about this. I don't know if you've got going through the list of my children's toys. Still back to marbles. So if you think about how you arrange marbles in a pub or an area, you think on a piece of paper. Then you might think you put everybody in grids. That may be good, but also you might want to think, well, actually, there's a better way of doing that. You might want to pack them in sort of hexagons, and that's the sort of way that billiard balls or snooker balls are arranged. So you can think about that, and that's fine. But what happens if you're that central billiard ball or snooker ball trying to get out? You've got to arrange for everybody else to be 2 meters away from you. So you've got to think about these sort of things. It's not just you, of course, it's everybody else. And of course, I think, I remember back to my driving lessons when people were thinking about how do you avoid crashes. It's not how good you are as a driver, but it's everybody else. And, you can be as well behaved as possible, but you just need one other person, perhaps to mess that up for everybody.
And just finally, there's been more talk about, in essence, the sort of, I was going to use the word old-fashioned. I don't quite mean that in the sense, but it is the sort of basic way of epidemics, isn't it? Contact tracing. We were told that we'd sort of moved beyond that, but there's talk about that being a way out of this. That somebody shows symptoms and then they contact trace everybody that they've been in touch with.
Well, that's right. And I think that was the government's strategy right at the beginning of this, when you had very few cases. And then you could say, if people present with symptoms, you can say, well, who have you been in contact with? And then Public Health England were going around trying to get those people isolated from everybody else. And that can work if you've got a very low number of infections and you can trace everybody. You said, one of the things is that if people aren't showing symptoms, how do you know that they've been infected? And so, I think there's a lot of work going in to try and use apps and other things to try and make that easier.
Am I right, Duncan, just finally, am I right in thinking that actually that's what makes this virus so difficult? Because unlike things like, heaven help us, things like Ebola or SARS even, it presents very quickly. So you get infected and you've got symptoms, whereas this, you can be infected and never have any symptoms but still be able to pass it on, or you can be infected and not get any symptoms for some days.
Well, I think that's right. People can carry and transfer this virus without knowing about it. Some people, obviously know they've had something, and of course some people will be very affected by it. But there is this sort of hidden spread that goes on, and that's why, you go out and you do look at people passing and think, well, how's this happening? But it's a very hidden thing that's going on, and that's what makes it so difficult to control.
Duncan, as always, it's great to have you on the show. Thank you for keeping us up to date with the science behind all of this. And can we chat again next week?
That would be perfect. Thank you very much.
Brilliant. Thanks, Duncan. Thank you. There you are, Dr. Duncan Robertson, who is an expert in all these matters and just kind of keeps us grounded with where we are in the science of it all.